Okay, hello everybody and welcome to our Wednesday webinar. This is being recorded, but don't worry, you won't be recorded in it. It's just going to be whoever is speaking. So it will be myself doing the introduction and then handing over to Nancy. And then at the end of the webinar, there'll be time for a Q&A, but we're going to turn off the recording then. So this is just us, so don't worry. My name is Hazel Ackland. I'm one of the 3 co-directors of the Nest Southwest. If you haven't heard of us, or if this is your first time doing something with us, welcome, welcome. We are a small social enterprise based in Exeter in Devon, and we work to support women, girls and menstruators through the transitions of menstruation, pregnancy, birth and the menopause. And we do this through operational, sorry, got distracted there, informational, social and all these things happening. Offering informational, social and emotional support. And we offer peer support groups, education, workshops and things like this webinar. So welcome. And this evening I'm handing over to Nancy Osborne. She's going to introduce herself and run the webinar this evening. So over to you, Nancy.
Thanks very much, everybody. So yeah, welcome everybody. Thank you so much for coming along tonight. It's really lovely to see you and lovely to see some familiar faces as well. I'm actually going to share my screen because I'm going to be offering a PowerPoint with you tonight. So I'll just get that up a moment. Okay, so hopefully you can all see that. Can I see some thumbs up if you can see it? Fantastic. Okay. So yes, we're going to be talking about physical activity in pregnancy this evening. So yeah, lovely to see you all. Thank you for coming. And I can see, and I've seen that they're arranged tonight. Some people who are pregnant, some people who aren't, some people who work with pregnant people. So wherever you come from, whatever your background, I hope you do get something out of tonight's session and you're left feeling motivated and inspired. So first of all, a little bit about me. So if I just, hold on a minute. Oh yeah, there we go. So yeah, my name's Nancy Osborne. As well as being one of the directors for the Nest Southwest, I'm also a chartered physiotherapist working at the Nuffield Hospital here in Exeter. So I specialise in orthopaedic rehabilitation and musculoskeletal therapy. And don't worry about what all those words mean, but it's generally sort of joints and things like that. But in the last year or so, I've been reading up and studying lots about women's health, and I have a particular passion in pregnancy and postnatal. So I've done various courses through the Borough Education as well as the POGP, Pelvic Obstetric Gynecological Physiotherapy Organisation, and I'm also a trained mummy MOT practitioner. And most importantly, I am a mum of 2 as well, so I have been through this before twice. Okay, so like everybody is in life, I'm always learning. So I try to bring as much of the sort of knowledge and experience to you in this webinar this evening. Might not know everything, and that's okay. But we'll talk a little bit about specific things in the Q&A, and I'm looking forward to seeing what questions you have. Okay, so what we're going to talk about tonight then, and what the content of the session is that I'm going to run through some of the benefits of exercise in pregnancy, and we're going to bust a few myths. Okay. And we're going to mention and go through the physical, psychological, emotional changes that occur during pregnancy, look at exercise recommendations and contraindications, talk about the pelvic floor and core musculature. I'm a physio after all, and then mention about some practical tips and suggestions for managing specific aches and pains. And then, of course, we'll be left with the question and answer session at the end. So halfway through that, we will have a 5-minute sort of comfort break. Okay, yeah, all right, so I hope you enjoy. So first of all, I think I'll talk to you about the myths. Okay, so we all know that physical activity is generally good for us, but perhaps you're pregnant for the first time and you're a bit worried about what to do, how much to do, and it's normal to have that worry. Okay, but some of the myths out there, or maybe some conversations you've had with friends or family members who have all good intentions, might just say certain things that may trigger and make you worry. Maybe some of those things are, exercise, you've got to be really careful. It increases, it could be, if you do too much, it could lead to miscarriage or preterm birth. You must always take it easy. So exercising in pregnancy is vastly researched, and there is no evidence out there in low risk pregnancies that any physical activity is going to cause any damage to the baby. So a lot of people might sort of worry that maybe running, for example, kind of causes your baby to jiggle about and bash its head and all these sorts of things. It's very, very contained and snug inside of there, and our bodies are designed to move. So one of these things is that you must always take it easy and keep your heart rate low to a certain level. So this might be a myth. And in actual fact, you know, again, research states that if you increase your maternal heart rate, this will obviously lead to an increase in fetal heart rate, but it actually has benefits for you and the baby. But only if you keep it under a certain level. So it's just listening to your body essentially, and we'll talk a little bit more about this as we go through the presentation tonight. When we exercise, blood flow changes. Yes, we're going to get more blood flow to some of the muscles in our body, and it changes the way where the blood flow goes. But it doesn't cause any risk. There's always going to be a sufficient amount that gets to your baby at moderate levels of exercise. One of the other myths might be that you can't play sports when you're pregnant. So you might be involved in a particular sport, whether it be football or a group sport or an individual sport. Really, it's about you can continue your sport depending on what that is, as long as it's fully practical. So, for example, if you're a golf player, as we go through the physical changes of pregnancy, you might have an altered your balance may alter a little bit, and this might put the trajectory of your golf swing in a different way. So it might be that you don't necessarily compete whilst you're pregnant, but you can still play and do some of these activities. Another myth: exercise leads to dangerous overheating and dehydration. Okay, so yes, there has been links with overheating in the body and neural tube defects in the first trimester of pregnancy. So it's really important to obviously make sure that you don't get too hot when pregnant. When you're exercising, and make sure that you stay fully hydrated as well. So if you live in a hot country, or if you're pregnant in the summertime, just making sure you're choosing certain parts of the day, not in the mid heat of the day, but choosing to exercise, when we're out of those significant times of the day, and or in air conditioning. Exercise will make you feel exhausted. Well, it's actually paradoxical in the fact that the more you rest, the more tired you feel in a way. So exercise and activity can give you energy, and ultimately it can help with your sleep patterns as well. So on the other hand, if you feel exhausted after doing a particular workout, it might have been that you pushed it a little bit too far. So you should never feel absolutely exhausted that you've got to go and have a lie down after exercising. But it's good to exercise so that you do have that little bit of energy with you. I will mention about altering the levels of exercise in different trimesters as we go through. Running may be unsafe, but whilst being pregnant is not a time to run marathons and that kind of thing. In fact, if you are a runner and you were previously running, it's safe to continue running throughout pregnancy until you feel, feel comfortable. If it starts feeling uncomfortable, it might be signs to slow down a little bit, alter your running pattern, or just stick to walking. You might have heard it's dangerous to lift weights. So although lifting weights, heavy weights repeatedly, is linked to spikes in blood pressure, actually often it's about the way you lift. And we all need to lift things as we are pregnant. So you might be, a mother already to toddlers, and you will need to lift the toddler whilst you're pregnant. And there's just no way of getting around that. But often it's about how you lift, and lifting in the right way, and using your breathing. And as we will explain later, lifting weights, light weights in particular, sort of light weights and high reps of light weights is absolutely fine, and is a good way to add in a bit of resistance training into your workout. If you've been advised to bed rest, then you might hear you can't exercise on bed rest. Well, actually, there's lots of things you can do if you're resting. So whilst you're in bed, it's really important to maintain circulation. So you can be moving the feet and the hands, be focusing on your breathing exercises, posture, be working on keeping those leg muscles strong by pushing the backs of the knees into the bed. So there's lots of exercises you can do whilst in bed. Also, no, it's no big deal if you don't have time to warm up and cool down. Now, this goes with any form of exercise, really, and it's really important to avoid injury. Particularly, you don't want any injuries when you're pregnant and have to deal with that as well. So warming up sufficiently and cooling down is a really big part of your sort of workout. Only prenatal exercises classes are safe for pregnant women. Well, yes and no. I mean, one of the benefits of a prenatal exercise class is that it builds community and you meet other people who are pregnant. But actually, you can attend any exercise class that you want to, but it's really important that you mention to the class instructor that you are pregnant, how many weeks you are pregnant, and if you're getting any particular, symptoms or so. All right, so it's fine to do generalized exercise classes, but just make sure that you tell the instructor. You can't do abdominal exercise in pregnancy. Well, actually, in the first trimester, so those first sort of 12 weeks or so, you can do most abdominal exercises, such as sit-ups and crunches and those kinds of things. They don't cause any harm, but it's just as you progress through your pregnancy, particularly after about 23, 24, 25 weeks, and when the size of the baby is growing a little bit more, and if you lie on your back to do abdominal exercises, that can put a little bit of pressure onto your blood supply up to your heart. And you don't want to be putting too much load through your abdomen as you progress through pregnancy as well. And for some people, it can make you feel a bit sort of lightheaded and faint and dizzy. But just with the initial part of the pregnancy, abdominal exercises is okay. All right, so now this is a busy slide. I'm not expecting you to look at everything on there, but it's just to show you that there are lots of changes, physiological changes that occur in pregnancy. We need to eat differently. Our bodies will change in shape. We might get a few aches and pains. There will be changes in our cardiovascular health. Our heart actually grows in size, which is amazing, to help pump more blood around the body and feed the baby. With blood. We have changes to the urinary and renal system. The uterus obviously increases as you progress. Hormonal changes, skin changes to the vagina, gastrointestinal changes, your breasts, and also your breathing. So it's just that there is a lot going on. And so it's vital that we are active, but we are aware of the changes that are happening in our body, and we're listening to that. So this image really dictates that, of course, we know that our bump grows in size as we progress through that pregnancy and baby grows. I couldn't get an image which sort of showed you some of the changes that occur in certain body parts, but if I go down from sort of head to toe, as our posture changes, so does our spine and the way we hold ourselves. So if we're not sort of fully aware of these changes, we can kind of adapt in ways that are a bit unhelpful. So it might be that, your neck sort of increases in its curvature. We might be making more of a sort of chin pokey position. Our shoulders might round. And to our belly, as the belly and the bump size grows, it might cause a little bit more of an arching in your lower back, and as a result our bottom muscles might not work as we'll need to work harder. There's some changes in the back of the knees, our feet can change. So again, this is just to indicate that there can be a lot of sort of those physical changes in our body. And also to mention about the physical changes, pregnancy is also an emotional roller coaster as well. So I love this slide because it just talks to you a little bit about those kind of highs and lows, and that is completely normal as well. So the highs when you find out about initially about being pregnant, but then in those first 2 weeks, you might get those lows where you get that loneliness, that feelings of isolation, can't talk about it yet, maybe a bit of anxiety about sort of previous situations, maybe feeling a bit tired, sick, nauseous. So just being aware that it's normal and it's okay to have those emotional effects. And we know that exercise can help to manage some of these feelings of, or balance your emotions, if you like. So, leading on to the 12 weeks or so, again, it's nice excitement, and you seeing the baby for your first time, you're finally able to tell people, and hopefully, all being well, the pregnancy will continue to be healthy and well. But there may still be underlying anxieties about test results and growth scans and that sort of thing. We'll then get that, excitement again leading up to the time, that nesting, that leaving work, but then the anxiety about the labour, and then the birth itself, which is an incredible experience, and or not. So, and again, that sort of varies with individuals, and then you might get the continued flow of those emotions afterwards. So just really, really important to consider that we have emotional roller coasters, and we need to balance our physical activity to match that. So how can exercise help? So again, with any physical activity, exercise can help with your weight gain. Now, it's normal and it's important that you gain some weight in pregnancy, but by being physically active, it's helpful to make sure that you're not putting on too much weight, and also it helps you to maintain that weight after you've given birth as well. So it helps to improve your general stamina, especially if you've got children already, keeping up with toddlers, and your job, whichever that might be, and it helps to maintain heart health as well. Physical activity, lowers, keeps blood pressure at a good level, and reduces the risk of blood pressure related issues, preeclampsia. Also helps reduce the risk of gestational diabetes, boosts your mood, okay, so you feel good when you're doing it, and afterwards it can help relieve some of those back and pelvic pains that you often get throughout pregnancy, and helps to manage some of those physical changes that we mentioned earlier. It can help fight fatigue and give you more energy, and therefore improve your sleep. It helps to relieve constipation, which is by increasing the flow through our gastrointestinal system. Prepares our body for labour. So, for some, labour might be a lengthy process. For some, it might be very, very quick. But, if you're wanting to do an active birth, or looking into active births, being in positions such as all fours or squatting or walking around, you need to be able to build the strength in your muscles to maintain that for certain periods of time. So it can really help for the actual labour. And if you're active, physically active, it can help speed post-delivery recovery. There's a study by Waterland et al., which sort of indicated that the level of exercise starts in the womb. So it sort of mentions that when you are physically active, it translates into your baby, and then when they're born into sort of a family of physical activity, and therefore it just gives a positive sort of reinforcement going forwards into the world. I think they did a study on mice, actually, and they found that the mothers who were active in pregnancy and gave birth, their offspring were more sort of naturally inclined to be active as well. However, there's still a lot of people who only fit in, sort of show that only 15 people are doing the recommended levels of activity. Okay, so what are these recommended levels of activity? So hopefully you've seen this, because this has been quite widely shared, but this is an infogram written by the Department of Chief Medical Officer, Department of Work and Health, supported it, but it mainly indicates the amount of time and what to do sort of during pregnancy for our physical activity. So we recommended that 150 minutes of moderate intensity activity each week. Now that might sound a lot initially, but if you break that up through the week, it's around 20 minutes or so each day. So what's really important is that actually every activity counts in bouts of at least 10 minutes or so. So you need to be doing something for at least 10 minutes to kind of contribute to those minutes, if you like. They can be for doing anything, anywhere from the home, such as sort of generally walk around home, housework, going up and down the stairs, just moving around in the house, playing in the garden, perhaps doing a video, Zoom video or Pilates, yoga, or on the television, or even just your own practice. Being out at the leisure centre, swimming, going to the gym, maybe even dancing around your kitchen, going to a dance class. These are all safe exercises. Being out and about, just generally being out shopping, riding a bike, being with family. These all count to contributing to those 150 minutes a week. And on top of that, we need to add 2 to 3 sessions of resistance training as well, just to maintain and build the muscles in our body. We know that there is no evidence of harm of physical activity in low-risk pregnancies, okay? But it's all about listening to your body and adapting as you need. And the recommendation is obviously sort of don't bump the bump. So that takes into consideration types of activity that you might want to do. So what exercises are safe in pregnancy? So it might be quite useful to split these up into sort of cardiovascular ones that sort of work on increasing your heart rate a little bit and getting that blood flow going. So swimming is a really wonderful form of physical activity. It just takes the weight off. It just makes you feel really good, especially during those later stages of pregnancy. And it works all muscles of the body. So not just the sort of legs, upper body, and core. So it's just it's a really lovely way. And any stroke is fine, whichever feels comfortable. You might want to avoid doing backstroke after sort of 25 weeks or so. Walking is great. Okay, you can, unless you have any sort of other physical aches and pains, it's one of the best forms. And we live in Devon down here, so it's hilly. So you can get opportunities to increase the heart rate in quite short spaces of time. So just keeping active, keep walking. And for some people, running might still be an activity of choice. Gyms, group dance or aerobics, cycling, and probably indoors is safer due to the lower risk of falling. But of course, if you feel like you're a proficient cyclist and you are aware because of your balance and your changes and that balance coming a little bit off center as you progress through your pregnancy. Remember, as the baby grows, your bump grows and your center of gravity moves forward, so you will have to sort of adapt to maintain that balance and that awareness. Even kickboxing, because kickboxing is a type of activity where you can go at something rather than something coming at you. So if it's something that involves coming at you, and obviously that produces a bit more risk of bumping the bump, but actually if you're in a controlled environment, and again, if it's something you've done before, it's something that you're probably likely to be able to continue as you progress through pregnancy, but obviously listening to your body. You might be thinking about whether it's an activity you've never done before, whether you should try. Usually higher level exercises such as this is probably not the time to try it during pregnancy, but there are some other lower level type exercises like Pilates or yoga. Again, that sort of focuses on the strength, but we've got the mobility, and you can also raise your heart rate in doing certain exercises in flows during those classes too. And obviously just being outdoors, and just building a love of being outdoors, hiking, biking, wherever you live, cross-country skiing, that's probably not here, but, which just being outside and feeling the benefits of being outside in that way. So some of the strength exercises and groups of exercises doing weightlifting. So we talked about like how you're lifting and the level of weight. So it shouldn't be sort of repeated high weights, but you can do repeated low weights in a good form. And then all the other sort of lower level strength exercises with your own body weight, Pilates, barre, yoga, and Tai Chi. And Tai Chi can be really beneficial for sort of working on those kind of softer movements and, those sort of emotional balancing. So there's activities to consider avoiding. Now, so contact sports, so high level contact sports, rugby, football, basketball, some martial arts, like to an intense period, to an intense level, these probably they do need to stop, because there is risk of injury to you in other parts of the body, but also impact around your abdomen area. And sports where there is a risk of falling: horse riding, skiing, off-road cycling, gymnastics, scuba diving and skydiving for obvious reasons. Exercising at high altitudes, it's probably not a good idea to sort of go off for a ski season suddenly if you're used to living at sea level when you're newly pregnant and progressing through that, because your body just won't be able to, won't be able to sort of cope with that change in altitude. And circulation. And also you need to be really cautious with exercising in hot temperatures, including yoga, Pilates and hot yoga, because you don't want to raise your core temperature too much, especially in the first trimester, as that is linked to some developmental defects. So just keeping your body temperature steady and not overly sweating. It's good to get that heart rate up, but we don't want to sort of overly sweat or feel kind of dizzy and exhausted from it. So just keep hydrated if we find that you're getting hot with it. So when it might not be possible to exercise. Now, there are some contraindications, and as long as your sort of GP or healthcare provider says it's, you're happy to do exercise, then obviously that's when you can do it. But if you'll know if you have any of these things, but you need to proceed with caution and speak to your healthcare provider if you have any significant heart or lung disease, an incompetent cervix. So this is where the cervix can start opening at from 20 weeks sort of pregnancy, to know if that is happening, it's going to require an examination by your midwife. Obviously, you might not know if you have this, but if you've been told that you have this, you just need to proceed with caution. Maybe just do low-level exercise. If there's multiple gestations, so if you're carrying multiple babies at risk of premature labour, if there's persistent vaginal bleeding or placenta previa, and this is where the placenta is covering the cervix beyond 28 weeks of pregnancy. If you have ruptured membranes already, so if your waters are broken, if you have uncontrolled diabetes type 1, 2, or gestational diabetes, if there's any evidence of intrauterine growth restriction, you have already the pregnancy-induced hypertension or preeclampsia, and any uncontrolled epileptic seizures. Now, I suppose the main word here is uncontrolled, okay? Because if it's controlled, you're likely to be under the care of a specialist, and then you can ask them questions as to how much, you should exercise and what sort of levels you can keep it at. When to seek advice. So there may be things you don't have in that previous list, but some certain symptoms arise whilst you're pregnant and exercising. So whilst it's not normal to, it still can happen that you might get a little bit of spotting or vaginal bleeding. But if this is particularly persistent, then it's really important to seek advice. Regular painful uterine contractions. It might be a sign of labour starting, it might be Braxton Hicks, but either way, it's really useful to speak to your to triage midwife and get some recommendations. If you have any, if your waters break, or if you have any amniotic fluid leakage, then seek advice before proceeding. It might be that these are the early signs of your labour, and it doesn't mean that you should stop altogether. And actually there's lots of people who progress and walk, progress through their labour by walking around and doing certain, dancing even in their labour. So it's just it's listening to your body with that. But if your waters are breaking, it's probably worth telling. It's definitely worth telling the midwives that that's happened. Okay, so shortness of breath before exertion. So this can indicate sort of oxygen supply. So just being mindful of that, and it's normal to get a little bit of short breath when we're exercising, but before exertion is when we need to speak to somebody about it. If you're getting any persistent dizziness or faintness or headaches, these can be linked to maybe symptoms of preeclampsia. So really do tell somebody about that if you're getting those symptoms. If you're getting any severe chest pain or any muscle weakness affecting your balance. Calf pain, heat or significant swelling needs to be a useful thing to identify, as that can be signs of a sort of DVT. So you need to, if you start getting any calf pain or even any chest pain, you need to speak to somebody straight away. If you start noticing any reduced fetal movements or persistent swelling or puffiness around the wrists, so it's normal to get a little bit of swelling in the hands and wrists and feet, but obviously if it's persistent and especially if it's painful, then that needs to be spoken about. If you get any itchiness, this can, you know, if you get sort of widespread itchiness around, then that needs to be noted as well. You need to tell somebody about that. And that can be linked to something called Obstetric Codeostasis, which is all about the reduced flow of bile down the bile duct, which builds up bile salts into the bloodstream. So you need to tell somebody about that. Obviously, if you get any noticeable increase in thirst, that can be linked to onset of gestational diabetes. And obviously, if you get any persistent or increased pain in the lower back or pelvis, then this is not something you have to put up with and can be assessed by a physio or your GP, and or your midwife can refer you on if needs be. And also, if you get any incontinence issues, bowel issues, or any pelvic floor dysfunction, obviously that's an area which I work in. So I would obviously say that it's really important to go and seek advice if you do get that, because you don't have to put up with that, and it's not necessarily normal to get it. Yes, you're going to have a little bit more pressure pushing down onto the pelvic floor when you've got a little bit more, carrying a bit more weight, but actually there are ways that you can help to manage that. So tips for pregnancy safe workouts then. So if you're new to exercise, then it's a really good opportunity to start doing something, okay, to build good habits. And if you're new, just start slowly, progress, and just listen to your body and go steady. If you're already exercising and you're already keen on the gym, great. Don't go overboard, listen to the body. Stay cool, drink plenty, and pack a snack. So a useful time to exercise is really, sort of fairly shortly after a meal. And if you do start feeling like a little bit dizzy, sit down, have something to eat, have something to drink, okay, and then let that settle, okay, because we can use up that energy supply quite quickly being pregnant. Warm up and cool down properly so you avoid injury. And just exercise enough that you're able to hold out a conversation. So a useful tip here is to think about something called an RPE, your rate of perceived exertion. So you might just kind of need to tell yourself, like, how much do I feel like I'm exerting myself on a scale of 0 to 10? So it's a good, if you want to sort of aim for a fairly high level workout, 6 out of 10 is maximum. Any higher than 6 is probably that you're working too hard. Keep off your back after 23 weeks. That's due to the pressure of the baby onto the blood supply and the vena cava, which sends blood back to the heart. So just you can modify the exercises there by rolling onto your side. So any relaxation classes you might attend, just rolling onto your side rather than your back to avoid that kind of compression. During the later stages, second and third trimesters, we need to avoid sort of doing big range abdominal exercises such as full sit-ups, double leg lifts, deep back bends, any jerky movements, those kind of things. You just need to go a bit more careful with that, and it's not the time to be doing sort of your plank, personal record. So just there are plenty of abdominal exercises you can do, and like I'll mention later, doing them in functional positions are going to be much more effective for you and useful for you, rather than doing the kind of full sit-ups if you're used to doing that. Dress for success, so wearing loose, comfortable and breathable clothing is really important. That helps to obviously keep your body temperature down and just makes generally exercise more comfortable. If you struggle with motivation, then perhaps sort of exercise with a friend or a relative, perhaps set an alarm, write it in your diary, induce sort of relaxation sessions before bed, put stickers around the house, those kind of things. If there's something that helps to motivate you, ticking off on a list, that might help some people, then do that. Gaining support network, so set an example for future generation, get the family involved, go out for walks together, and induce good habits going forwards. And most importantly, finally, is don't bump. Okay, so just the final bit on this section here is really general exercise modifications through the trimesters. So your first trimester, the first 14 weeks or so, yes, you're probably going to be feeling tired, nauseous. Your body is adapting to these influx of hormones. So it's really important that rest and gentle activity is probably the paramount and most important sort of attention at this stage in pregnancy. For some people, they don't get any of these symptoms, but some they do, and some of these symptoms continue through the trimesters. So again, it's just going back to adapting and listening to your body and doing what feels right for you. If you booked in to do a walk with a friend and you're feeling absolutely just shattered, then having a lie down and doing a yoga nidra instead will be the best thing for you, and your friend will understand and maybe join you. So the second trimester, so the sort of middle section, is usually when you've got a little bit more energy. So this is a really good opportunity to start thinking about looking on to building functional strength, fitness, flexibility as you progress through your pregnancy, and becoming much more aware. You'll be starting to notice the physical changes a little bit more. So just being aware of those and continuing to maintain that awareness. And then finally, into the third trimester, as you start leading towards labour, you'll get these occasional bursts of energy, but you may also get that sense of nesting and resting. So it's all about sort of trying to find a balance and doing what feels right. All right, so I thought we'll just go for a little bit of a 5-minute break, get something to drink, go to the toilet, and oops, let me do that. So I don't actually have the time. I might have to pass you back to Hazel with that one. And we'll come back in 5 minutes time just to go on to the next section. Thank you. Right, so here we go. Let's get back on track. Okay, so we're going to talk about the core and the pelvic floor. So really, really important parts of the body to consider, during pregnancy and beyond. So first of all, we'll just mention about the pelvic floor. As you can see here, this is a model of the pelvis, and it's a model of the pelvis looking down. Imagine we're in the body looking down and out the anus and the vagina. So the pelvic floor musculature, they're groups of muscles, muscular slings that attach and are the base of your pelvis, really. So they attach at your coccyx and to your pubic bone, and also from side to side at your tailbones, your ischial tuberosities. And you can see that there's different directions of muscle fibers here because they need to sort of work in slightly different ways. And actually, the pelvic floor musculature is slightly larger at the back towards the bottom than it is at the front. So pelvic floor is the function of it really is to manage bladder and bowel function. It wraps around the bladder neck to control the output of urine, and obviously around the anus to facilitate bowel movements and evacuation. It also is contributes to sexual pleasure as well. But it's really important because obviously the pelvic floor talks to a lot of the other muscles around the core and the trunk and the lower limb. So it actually works in synergy with muscles down the inner parts of your legs into your glutes. It's got a real sort of close interaction with our glute muscles as well as our tummy muscles and back muscles. So moving on to this next diagram here, this just mentions about our core cylinder. Now, our core isn't just our six-pack, if you like. Our abdominal muscles are made up of 4 different groups, actually. And the deepest layer of those abdominal muscles is a muscle called the transverse abdominis. Now, it wraps around the torso like a corset. So you can see these sort of muscle fibers moving around and just kind of draws everything in. So it's by activating the transverse abdominis, you're imagining it's using the muscles you might imagine that you would if you were tightening the belt and trying to draw your belly button backwards. Those are your sort of deep core muscles, rather than the six-pack muscles. The rectus abdominis are the ones which help to lift your head and shoulders up at the floor when you're lying on your back. They are important in maintaining strength in your core, but not as important as these deepest layer here. So we've got the pelvic floor and we've got the transverse abdominis, but above the pelvic floor is the diaphragm. Now, the diaphragm is our main breathing muscle. So when we breathe in, our diaphragm moves down, and as it moves down, it actually pushes down the pelvic floor. So our pelvic floor mirrors what our diaphragm is doing. So as we breathe, our pelvic floor is also breathing. Okay, so as we breathe in, the diaphragm moves down, actually pushes the pelvic floor down as well. As we breathe out, our diaphragm moves back up again, and also the pelvic floor muscles move up. And if we do a pelvic floor muscle contraction, we're moving up even more. And we'll talk about that in a minute. So the pelvic floor, the diaphragm, the transverse abdominis, and also the deep back muscles here. So multifidus is one of the spinal muscles here, runs along the spine. So these all work together to maintain a sort of core synergy, if you like, which helps to, when we were aware of this and we were able to sort of activate it with certain exercises, we're able then to help manage lower back pain and pelvic girdle pain, and various other conditions that might affect us more in pregnancy, sciatica, that kind of thing. So I just thought it'd be really useful to mention that. I'm not going to go into loads of detail about this because we're going to be doing a sort of postnatal recovery webinar as well. And we're going to invite our guest speaker as well, the postnatal physio, to talk more and share her wisdom with that as well. So, but I am going to teach you how to do a pelvic floor muscle contraction because these are really important to do in pregnancy. It's a good opportunity to start doing if you're not doing it already, and you've got to keep doing it afterwards because it is like brushing your teeth. It's a kind of learning how to do it needs to become routine so that we can help to control our bladder and bowel movements. And actually throughout pregnancy and afterwards, if there are any continence issues, then it's not normal to put up with these issues. So by looking at pelvic floor exercises and starting them early can put you at a lower risk of developing pelvic floor dysfunction postnatally and beyond. So how to do it? So we know that breathing is involved in a pelvic floor muscle contraction because when we breathe, our pelvic floor moves. So what we need to do is contract it as we breathe out. So you can join in if you like, but I'm going to just talk you through the steps. You always breathe in to prepare. Okay, and the best positions to practice pelvic floor exercises, by the way, are in lying down, either on your side or on your back with your knees bent, or in sitting to start off with. It's hardest when you're in standing because it will be against gravity. Okay, so just be something to be aware of. So you always breathe in to prepare. And then as you breathe out, you start to tighten the muscles around your back passage as though you're trying to stop the flow of wind, because we know those are the bigger muscles. And then you start to tighten up around your vagina and urethra, imagining you're trying to stop wee. Now, it should feel like a squeeze and a lift up and inside the body. Ideally, you want to hold it for up to 10 seconds, but not everybody will have the endurance yet of the muscles. So just hold as long as you can, but don't stop breathing. It's really important to hold it, but continue to breathe. Try to avoid clenching your buttocks, tensing your abdominal muscles as you do it. And after each squeeze and let go, make sure that you relax your pelvic floor muscles by letting them relax to their starting levels. Okay, so the aim is to aim for sort of 10 slow contractions. So that's holding them, for as long as you can. 10 seconds is the ideal, but for most people, 10 seconds is a long time and it's difficult. So maybe start with 5 seconds and then build up slowly. So you do 10 slow and then lead to 10 quick. So the quick ones need to be a sort of contract, release, that sort of speed, contract, release, rather than contract. Because if you don't release it, it just tightens up, and then a tight pelvic floor can have issues as well as a weak pelvic floor. So the knack is where you learn to switch on your pelvic floor muscles before you sneeze, cough, or strain. So when you do anything that causes more pressure to build up inside the abdomen. So when you start doing your slow and quick contractions, you'll learn to engage it and then to perform your high sort of load activity. And that's something called the knack. All right, so that's how to do a pelvic floor muscle contraction. So hopefully that's helpful for you. And I can send you some other information if you need to about that and learning it. But then there's also lots of apps that you can download to follow if you feel that you need that extra motivation. And ideally, 3 times a day, if you can remember, or certain times of the day, such as when you're waiting for the lights to change, if you're in the car, or if you're sort of walking on your way to work, or if you're breastfeeding, or when you've had your baby, or if you're just waiting, did I say waiting for the kettle to boil, those kind of things. So as well as activating your pelvic floor, it's really important to relax your pelvic floor, because like I said earlier, a tight pelvic floor can be just as symptomatic as a weak pelvic floor. So in the next few slides, we'll go through and suggest certain movements, exercises, positions that you could go into to help you to facilitate certain or relax certain muscle groups. So by relaxing your pelvic floor means that it's able to start from a good resting position, and then you're able to engage it fully. Because like when something's tight, it's not going to move. If you've got a really tight bicep, for example, you're just not going to be able to move your arm, and therefore you're not going to be able to do sort of functional tasks, lifting your hands over your head and that kind of thing. So it's the same with the pelvic floor. So some of the exercises you could do to help relax that pelvic floor, just be a bit more mindful of releasing it. I'm coming into something called Dolphin Preparation, or modified child's pose. So just here on the top here, so being on all fours, having a block or a pillow or maybe a ball out in front of you, and you can't see it in this picture, but if you actually bring your knees out a little bit, it just might be able to create a little bit more space in the pelvis for you to relax through the pelvic floor here. And you might think about, sort of as you breathe in, just breathing in through that open space into your pelvic floor, and then breathing out, letting it go. Happy baby pose if it's in the first part of your pregnancy, because obviously it's lying on your back here, and the second one is great because you can see that it's stretching through the through the ischial-tuberosities, and it's just a really good position for you to sort of open out through your pelvis, and it's a great sort of hip stretch as well. Butterfly pose down here at the bottom, so in sitting. So sitting maybe on a block or a cushion or a pillow. You might want to put some support underneath your knees if your hips are particularly tight. Bringing your soles of your feet together, and then maybe just gently bouncing the knees, or just holding it in the position and just feeling a little bit of an opening through the inner thighs and the pelvic floor there, and just holding it and breathing and just relaxing and letting your mind calm. Okay, because when your mind is calm, that will send the signals to your body to release tension and relax. Also, perineal massage. So yes, it's not to do about your sort of fully about relaxing your pelvic floor, but it's around the area. So perineal massage is a technique that some women use towards the end of their pregnancy, just to sort of soften through the perineum to prepare for labour. And it's actually, researchers out there, it has shown to reduce the risk of perineal tears. So there are various grade tears that you can sustain going through a vaginal delivery. And if your perineum has a little bit more of a stretch to it, so the perineum is that space between your vagina and your anus. And as the baby kind of moves down into the birth canal and out through the vagina, it will sort of stretch it. And tears do happen, but by doing a little massage technique, again, I can send you more information on it if you need to. Usually involves yourself or a partner or somebody else just placing their thumb and just pressing down and doing a sort of circular motion sort of around the bottom side of the clock, just to give it a sort of a little bit of a pressure, a little bit of a stretch. You might want to use lubrication. Obviously make sure your hand is clean, that kind of thing. Might not be for everybody, but like I say, it has shown to reduce the risk of perineal tears. So managing aches and pains during pregnancy. So common aches and pains. Earlier on in the presentation, we talked about sort of how the neck and shoulders can become a little bit more sort of rounded, maybe a bit tighter. Maybe there's going to be an increased lordosis, increased curvature in the lower back, maybe the buttocks weaken, that kind of thing. If that's the case and we're not doing anything about it, it can develop to sort of lower back pains, pelvic girdle pains, hip pains, even rib pains, neck and shoulder tension, and pelvic floor dysfunction. These are the sort of most common sort of physical aches and pains that pregnant people sort of complain with. Now, it's really important to obviously get some guidance here if you are suffering from it. So do speak to your GP, pregnancy or pelvic health specialist if you are struggling to get more tailor-made specific advice. But before we go on and talk about sort of managing certain aches and pains, I want to talk to you about this hormone. Now, you possibly heard of the hormone relaxin, but it unfortunately gets a bit of a bad rep for, you know, causing kind of pelvic girdle pains and that kind of thing. And often you'll hear even health professionals say, oh, it's because the relaxin, hormone relaxin, it softens your ligaments and it causes your pelvis to be unstable. Now, for some people, they can really, really suffer from really bad pelvic girdle pain. And it's not helpful if you're told that it's because you've now got instability because of relaxin making your ligaments too lax. Okay, so I just want to kind of help you sort of understand that what this hormone does, and it's not necessarily the main culprit. So the hormone relaxin is produced by the corpus luteum and the myometrium, the wall of the uterus, in pregnancy. It acts with the hormone progesterone to maintain the uterine lining during pregnancy. So, and it also then inhibits these uterine contractions because we don't want those contractions too early on. It does soften ligaments, tendons, and soft tissue, and it softens the cervix. It also but it doesn't necessarily make the ligaments lax. So it also has cardiac and immune properties. So as well as just having the softness, it does other things as well. So cardiac and immune properties, as well as managing inflammation and reducing scar tissue formation. And studies out there have said that they found that ligament laxity doesn't correlate with serum, so that's sort of blood relaxation levels. So it does not mean that it does not cause the pelvis to be unstable. And if this was the case, because we know that relaxin is the hormone found in all pregnancies, if this was the case, every pregnant woman will have pain or pelvic girdle pain, and we know that that's not the case. So we can't always fully blame it on this hormone. So relax. So managing neck and shoulder tension. I'm going to start with this first. So as I have, as I'm a yoga and Pilates instructor, these are some of the exercises I often use in classes. And you'll find that if you go to these classes, they will sort of focus on this as well. The most important thing, this sort of neck and shoulder area in particular, is posture. Okay, so if you are a bit of a sloucher and you're just like, oh, exhausted at the end of the day, but you still got this kind of neck and shoulder pain, it's possibly not going to help if you're just going to slump back into that sort of position. So most importantly, if you're standing up and about, just think about imagining your head like a piece of string, a piece of string above your head lifting up towards the sky. Imagine your head like a helium balloon. Allow your shoulders to relax back and down. Have support behind you in your chair at work. Make sure you have a desk assessment. Those kind of things will really, really help. Hold up, look up when you're walking. We tend to hold a lot of our emotion and our stress in our shoulders. We know that pregnancy is an emotional roller coaster. So we're going to think about stuff and it's just going to creep up into our neck and shoulders. Our thoughts are all going to be up in our head. So just being mindful of that and taking a breath and exhale as you breathe out, just allowing your neck and shoulders to just soften, allow your chest to widen. So now and again, just focus in on, do a little bit of a body scan. Notice, am I holding tension in my shoulders? Sometimes it helps to just even squeeze the shoulders up and then just relax them down to the floor. Okay, and just doing a few sort of tense and relaxes there. Doing shoulder rolls, just rolling your shoulders around backwards. If you do that as just one exercise, it can actually help improve your posture anyway. So you it's really difficult to do a shoulder roll while you're slouching. So actually by just rolling your shoulders, it can already kind of encourage you to sort of come forwards into your posture. Neck stretches. So obviously our neck moves in all directions, just finding the end range of motion and just trying to hold it there and breathe and just allow and take time for those muscles to relax. So sort of going from the side, even rotation, just gently pushing right at the end of the range there, finding that edge and just holding it and breathing and using that out breath to relax into it. Cat-cow exercise here in the second picture down. So this is where you're on all fours, your knees are hip width apart, hands underneath your shoulders, and just rounding your back like a cat. And then inhale, just lifting your chest, rolling your shoulders back, allowing your belly to drop down. Just can really help sort of soften and mobilize through the whole spine. As we know, the spine's all connected. So if you might find that actually you're not moving your lower back, and that can translate up to your neck and shoulder area. side bend. So even just sitting down, where you're sitting cross-legged or even in a chair, and just bringing one hand to the side, making sure your sit bones are down, and just leaning over to the side and sort of enjoying that. You can either, go from side to side as you breathe, or you can hold it there and just breathe into the ribs here at the side, and just create that space and length through the side of the body. Again, all stretches and exercises should be approached with a little bit of caution. It's always about a balance of ease and effort. And nothing should feel painful. If it feels painful, you pushed it too far. So just, again, it's a listening to that body and staying within those kind of pain-free ranges. But you possibly might feel a kind of nice pain, if you like, or a nice stretch. It's difficult for some people to identify whether it's a stretch or a contraction or a compression. So if it feels sharp or stingy, that's not good. Where if it feels like I really needed that kind of thing, then it's probably a good thing. If you're not sure, then ask somebody. And finally, then, just another good exercise for the neck, back and shoulders is an exercise called opening, closing the book. So if you're lying on your side, stacking one shoulder onto the other, and then as you breathe in, you lift one arm up, look over the shoulder and drop it down beside you. And this is just really great for getting a lovely stretch right through the pectoral muscles here, and also brings in a little bit of a twist to the lumbar spine as well. Doing the same number of repetitions on each side. You can either flow in and out of the movement, or you can hold it in an open book position for 5 to 10 breaths or so. I always recommend holding for a number of breaths rather than 30 seconds, because then it ensures that you're breathing. And we know breathing is so important with just aiding relaxation and tapping into the sort of parasympathetic nervous system in our bodies. So the sympathetic nervous system is that sort of stress, fight, flight. And this is where, when we're stressed, we hold that tension in our shoulders, and we want to try and tap into the sort of rest and digest aspect of our nervous system when we're managing stress-related issues. Okay, so back pain. So looking further down the spine here. Now, back pain is probably the number one cause of sick leave, worldwide, and is linked to sedentary lifestyles and prolonged sitting, but also obviously it's linked to high overactivity as well. But I would say the majority of us are of that sedentary, with most people sort of having desk-based jobs. So it's really, really important to take breaks. And, when you're pregnant, you want to take breaks. You want to keep that circulation going. If you're sat at the desk all day, the circulation reduces. You need to keep your feet moving, you need to stand up, move around. That obviously not moving can cause more sort of pooling and edema and build up of fluid in the ankles and the wrists and things like that. So yeah, just keep going to manage circulation, as well as taking the pressure off your back and your spine. It will be important to change your support your changing posture and avoid lifting sort of heavy loads repeatedly. We talked about earlier about it's about how you lift. So you must always lift things, if you are lifting things from the ground, rather than kind of rounding your back to sort of lift things up and forcing it through the back. You want to use your legs to lift. So come into a squat position, bend your knees, stick your bottom out, weight through your heels, hold something with your hands, keep it close, and then lift it up. So it might feel that you look a bit stupid, but actually it's the way we should all do it. And if you look at young children, then they sit and they lift perfectly, because that's just how the body is designed, and so they use their body the way it's designed. And just with prolonged sitting, we sort of have found that muscle, the way we found ways of cheating a little bit of using certain muscle groups. Maybe you're used to wearing high heels and things like that, so through pregnancy you might find that actually heels kind of can make symptoms worse with back pain. So it might be useful to actually wear flats for and ditch the heels for a little while, and come back to them sort of post pregnancy. We know that wearing heels, especially high heels, causes your center of gravity to come forwards, and being pregnant causes your center of gravity to come forwards anyway. So you're having to work extra hard to keep that center of weight backwards in towards. So you might find that your glutes are overworking and firing, and then giving up and becoming weak and tired and tight, and then that translates up into your back. So if you've got sort of acute back pains, really, really tight, it's just gentle exercise, swimming, Tai Chi, yoga, Pilates, that kind of thing is ideal. I wouldn't go for a kind of like HIIT class or a sort of high level aerobics or anything when you're getting acute sort of back pain symptoms. Warm baths, massage, heat, all those sorts of things, giving yourself a bit of opportunity to rest and digest and reduce tension in the area. Maybe you'll need to see a physio or somebody just to manage any sort of radiating pains that you might have. Sometimes back pain can lead to sort of neural compressions. You may get some leg pain symptoms, and that will need looking at just to kind of rule out anything else. Cat-cow is a really good exercise. So I mentioned that in the previous slide. So that rounding the back and then dropping the belly, that's, you know, brilliant for all stages of pregnancy. Most people can do it, even if you've got pelvic girdle pain, just keep your knees together. But it's just a great way of kind of getting the back moving. Now, threading the needle here is a sort of mobility and strength exercise. So you need a little bit of upper body strength here. You can do it on your forearms if you need to, but it's really great for sort of building a little bit of rotational movement here in your upper back, because when you're thinking about lower back pain, we need to think about the joints above and below as well. So the areas above the lower back of your thoracic spine here, your sort of chest, perhaps you are quite rounded here, and that will, you know, lead to stiffness in the lower back. So this is great, and this is something I do often as well. So on all fours, reaching your arm up and then threading it through the opposite side, and then taking it back up again as you breathe in, reaching it through as you breathe out, and maybe holding it in this twist position for a few breaths can help as well. Seated twists are great. So even if you're just sitting in a chair, like the picture here above, and just looking over your shoulder, keeping your feet grounded to the floor, making sure you're nice and tall through the spine. And you always want to make sure that you're sitting on those kind of bony bits underneath your buttocks, those sit bones, just so that you're not kind of tucked under with your pelvis too much. Some people might prefer an extension, some people might prefer sort of more of a flexion position. Again, it's just about finding what fits right for you, making sure that you do the same each side, and you're breathing nice and deep through your tummy. And then finally, Supermum or arm and leg extension is great for building a little bit of core strength, and practicing through the pregnancy to tap into your changes of center of gravity as well, because this will change and alter as you go forwards, because the weight distribution will change. But opposite arm and opposite leg. So starting on all fours, having a go at extending the leg back, and then the opposite arm, making sure that your hips are pointing down and they're not twisting and lifting up, is a good exercise. So managing pelvic girdle pain. So pelvic girdle pain it's an umbrella term for a variety of areas, painful areas around the pelvis. So you might have heard the term symphysis pubis dysfunction. So the symphysis pubis is the joint right at the front of the pelvis here, where the your pubic bone is actually the pelvis, the left and the right side of the pelvis connecting together. And yes, there is a little bit of a softening that happens throughout pregnancy, and therefore there might be a little bit more movement, a little bit more shearing, and therefore a little bit of an inflammation. And that can sort of cause either pain in the area, or it can radiate outwards towards the hips and maybe down the inner thighs. Sometimes it can be really, really debilitating. And this is down to sort of a number of reasons. And there are risk factors associated with the development of pelvic girdle pain. Now, how to manage it. So things to avoid crossing your legs, standing on one leg, because then you're just kind of loading your whole weight on one side. If you do have children already, or if you're lifting objects, try to avoid carrying it on one side. So to see if you can distribute the weight equally as best as possible. Try to avoid sitting on the floor cross-legged. So there are ways that you can practice like a yoga class without being being cross-legged position. You can just sit kneeling, or being in a chair instead. Try to avoid any sort of prolonged sitting or standing, or heavy housework like hoovering. Just so you're not having to put sort of too much pressure through that sort of pelvic girdle area. But do support and engage your core. So do continue to exercise and move. So it's it's even more important to kind of really focus on that breathing. And as you breathe out, thinking about drawing your belly button away from your spine to get those transabs working, squeeze and practice your pelvic floor muscles to get that support from down the bottom. And when you're thinking about those areas, it will all kind of communicate with all the other muscle groups as well. Continue to be mindful of your posture, so similar to sort of general lower back pain. Finding a comfortable lying position. There's all sorts of pillows and things you can buy now to support a pregnant sleeping position, or just loads of pillows to sort of between the legs, behind your lower back, and perhaps if you're used to sort of lying on your tummy, you know, kind of recreating a sort of recovery position type movement, but supporting yourself with pillows so that you're not obviously on your tummy completely. Getting in and out of bed, you might need to do something called a log roll technique. So rather than kind of lifting up using all your core abdominal muscles, you might need to, from your back, lie and roll onto your side, and then bring your legs off and push up with your arms. So you're using your upper body to help you rather than just keeping all the force through your pelvis. Stay active, because we know that actually inactivity can exacerbate symptoms, and it's probably that can be a risk factor for developing this during pregnancy. So do stay active as best you can. If you do see somebody and you want to still keep walking, it might be that actually walking is something that aggravates your pain, and we can issue you with crutches. Looks disabling, but actually it may sort of keep you active, because it can help just offload a little bit, and you can get belts, and you can make your own with scarves and that kind of thing, just to give yourself a little bit of extra sort of support around that pelvic area. Adapt your outfit. Maybe it's the clothing you're wearing, maybe it's too tight or not tight enough and not breathable enough, so just adapting your clothing. It might be that you're so used to wearing sort of suits to work, and actually you need to think about a bit more sort of a stretchy fabrics. And do see somebody if pain persists and if it's really affecting your mood and your lifestyle and your function, because there is always something that we can do about it and explain in more detail and with more specificity to you. So finally, here with our sort of common aches and pains, is something called carpal tunnel syndrome, which is actually
just giving you a time check. You've got 10 minutes left.
Common than you think. So carpal tunnel syndrome is where, oh, thank you. Oh no. Okay, thank you. Gosh. Yes, thank you. So carpal tunnel syndrome is where you get that kind of compression of the median nerve, which runs down the arm, because of the buildup of fluid around your hands and feet sometimes. So if you do get this, you'll know, because you'll get some tingling possibly in your fingers. If that's the case, place an ice pack around your wrist for 10 minutes, elevate your arm to help manage the swelling, reduce time lying on maybe the affected side. And if you want to be on all fours, if you put something, a rolled up towel underneath the fists, then that can offload some of the pressure that you put through the wrists. And perhaps in some circumstances, you may need a wrist splint or see a specialist for advice. So I will nearly finish here. I wanted to talk about sort of resistance training. You might have some questions around that, but resistance training, we know we need to do 2 to 3 sessions of resistance training each week. You don't have to use weights. Your own body weight can be sufficient, and it should include the pelvic floor muscle exercises. Ensure you warm up and cool down sufficiently, and Valsalva is pushing down. So when you're sort of lifting up, you don't want to be pushing or bearing down through your pelvis, so avoiding that. And the types of exercises, we want to focus on movement patterns that are functional to being a mum. So pushing and lifting off of the floor. So pushing, squatting, so you're always going to be sitting to standing, lunging, that's going to be helpful for when you're sort of pushing the buggy, and starting to get back to walking. Calf raises, because we know that helps to manage the circulation through the periphery, and balance exercises. Oh, I'm so sorry for having to rush through that a little bit at the end. So lastly, just thinking about preparing for childbirth, keep active, but turn your attention towards the labour in those last few weeks. So rest in order to conserve your energy. All fours is a good position for that optimal fetal positioning. Mobility and gentle toning exercises are great at this stage, as well as sort of hypnobirthing and visualization techniques thinking about the labour itself. So use those positive affirmations and breathing techniques as well, which there is a plethora of information out there. Okay, so I do have some useful references here, and I just want to highlight the first one being the Active Pregnancy Foundation. It's a fantastic website. It's got loads of really useful links and videos, which are brilliant, and podcasts. At Your Cervix podcast is really great, and it's got lots of interviews with scientists who talk all about the sort of research related to physical activity in pregnancy, and the book When No One Told Me by Emma Brockwell is fantastic. Okay, so there we go. Thank you for listening. I'm sorry to have rushed the end bit there.
I'm sorry to interrupt you, Nancy. You were full in your flow and it was wonderful.
Yeah, sorry.
Passion for the subject just comes through. It's fantastic. What a wealth of information. You could almost do a per webinar per slide in there, I think. Yes, thank you so much.
All right, so it's opening out. I mean, if you have to go, then